Okay.
I think we can get started soon. Okay, well, good morning, everyone. Welcome. We're going to get. Yeah, sure, why not?
I can do that.
All right, thank you.
My silver seat.
All right, so thank you very much. So we've got a pretty good crowd today. My name is Dr. David Ajibade. I'm a medical doctor. I treat dementia and brain disorders. But more important than that, I love to educate people, especially seniors, on what you need to do to take control of your brain health. And I don't know if you all know this, but Baltimore City is #1 in the country for dementia. I know you, but I've seen you before.
I probably have dementia, so I don't know.
Well, we got to fix that. So like I said, Baltimore City is #1 in the country. People don't realize this.
Why is it that?
Different reasons, maybe because Johns Hopkins and the University of Maryland are out there searching for it. That's one reason why it can be higher up. And then a couple of others. Also population densities. So there are some populations have it worse than others, and there are different reasons for that. And of course, the fact that there's an industrial base here, a lot of industrial activity went on for quite a long time in the past, and there's still a lot of those toxins in the atmosphere and in the soil, lead toxins, for instance, and then a lot of old homes. So there are several different factors. I don't want to commit to one or two, but those are different things. But bottom line is that that's what we have. And so it is, in my opinion, extremely important. Can you hear me back there? Good? Okay, cool. Not too well. Any chance you could come forward a little bit? Because a little bit? Any chance? There are lots of chairs out front, out here. Okay. All right, but if there's something you want me to repeat, just go ahead and tell me. So we'll be talking about, in my opinion, everybody should have some kind of brain health protection plan that you are executing, and it cannot be the same for everyone. Each person, a white woman will have a different one than a black woman, for instance. I'm a black man, in case you haven't noticed. There are different factors that affect me. So we want to try to make it, number one thing is that we want to raise the awareness of people that it is your responsibility to have your specific brain health plan that you are executing on a regular basis. Because no one else is going to do it for you. The reason why people get dementia, and I'm going to show you in a few minutes, but the main reason why people get dementia is that things just happen to them along the way that they are unaware of, and that these things just build up and build and build over time, and eventually you get dementia. So we can't cover all that in one setting. So I'm just going to quickly say this too, that we are creating an online platform, especially in Baltimore, so that people can go on and then watch and listen to these listen to these videos in detail. So, yes ma'am.
When you say Baltimore, is it strictly the city or is it Baltimore City and County?
Baltimore City specifically.
Okay.
Yeah. Although I think Prince George's County too is very close by, very close to in terms of dementia. This is what we're covering. I'm not sure we'll be able to cover everything at once, but this is the main thing. I've already talked about taking responsibility. And taking responsibility means that you need to realize that the government is not going to do it for you, your spouse, your loved one, even God isn't going to do it for you. You got to do it yourself. Basic things, you need to know how your brain works and what your brain needs. Because if you don't know what your brain needs, then how are you going to provide it with what it needs? You cannot just assume that it's just going to get it. Have we met before? Okay, I keep seeing faces that I think I've seen before. Okay, maybe I have, but I'm just kidding. So dementia, as I said before, dementia is what occurs over a period of time as a result of, shall we say, assaults
or insults. Many times you are not aware of these things that are causing it. So I don't want to blame anybody, but the truth is it just doesn't come out of nowhere and tackle you and bring you down. There's usually a pathway, and in my patients, I usually see that pathway. Once you go through over their medical records and you go over their history, it's quite evident that these were the things that happened that made them have dementia. Now, most people have been made to believe that dementia just comes out of nowhere once you turn 65. Now it's even at a younger age. That is simply not true. It is not true. And I hope you leave here with some kind of empowerment that there's something you can do about it. Okay, let's get into it. So let's talk about the brain a little bit. If your brain is working well, it's doing several things at once. The unconscious processes, breathing, it's regulating heart rate, digestion, sleep, and so on. But it's also doing a lot of more, shall we say, more higher level consciousness. You're listening to me now, you're processing what I'm saying. You're understanding it based on what your background is. So you're combining it with what you know. So it's doing a lot of those different things. But the bottom line is that it needs to have the fuel. Everybody say fuel. Fuel. But it also needs to have the energy. Fuel and energy are not the same thing. Energy is what you get once you process the fuel, right? So the car needs petrol, but if the engine is not working well, it's not going to convert that petrol, or we call it petrol where I'm from, right? You guys call it gas. The car, the automobile has to process the gas to produce the motion and every other thing the car does, right? In the same way, your brain needs to have the ability to process fuel. Now, we all know the fuel to be what?
Food.
Glucose. In the final analysis, it's glucose. But sometimes some things go wrong and the brain is not able to process that glucose and convert it to energy. And that is when things begin to go wrong. So let me go back to this slide. If your brain is working well and if it has everything it needs, it's going to be doing all these different things that you can see. If it doesn't have everything it needs, it will not function the way it should. And this is an overview of everything that your brain needs. Obviously, oxygen, nutrition, fluids, it needs those things. But it also requires social connection, especially as you grow older. I know women are better at this than men are. Men tend to be more on their own, we can do it on my own. But women tend to be better at it. But it's not just that. Challenge, movement, information, learning things like you're doing. These are all vital for a healthy brain. If it's not getting these things, it will begin to decline. So that's why it's so important that you all engage in different activities. If the brain energy is low, now remember, it's doing all these different things. If it's not getting the energy that it needs, and the brain requires 20% of all the energy that your body produces. It's very small, it's like 2% of your body's weight, but it requires over 20%. So you can see where the problem lies. If your brain, being the energy hog that it is not getting what it needs, you are going to begin to see problems. And where we begin to see problems are in the parts of the brain that require the most energy, which are also the parts of the brain that make us more human. Speech, memory, the ability to calculate complex things, the ability to plan ahead, the ability to imagine, the ability to pay attention for a period of time. In fact, one of the first signs of dementia is that inability to stay attentive, maybe to what your spouse is saying or to what someone else is saying. That's one of the first signs. Again, attention requires a lot of energy. Memory also requires a lot of energy. So we're beginning to see what happens over time. So when we get to what dementia means, I'm going to give you two scenarios.
I like to call them the two Mikes. So Mike A was born to an alcoholic mother and had a tough time, given up for adoption, bounced from foster home to foster home. Some bad things happen in those foster homes. Eventually gets into kindergarten, high school, doesn't have good grades. He decides to go into the army. He gets deployed to one of those very dangerous places. He experiences a lot of war at the battlefront. He loses his friends. He has PTSD. He gets involved in drugs and alcohol. He comes back home. Finds out his wife has run away with their two kids. He finds it difficult to get a job. He keeps on abusing alcohol. He develops diabetes and hypertension. Very, very difficult life. Mike B is born to a middle-class home, loving home, has a wonderful education, gets a good job, he excels in his work, he's a volunteer in his community, he gives back. Now the question is, when these two Mikes turn 65, which of these two Mikes is most likely to have dementia? Mike A. Oh, why did you say that?
Because of his past experiences that his brain just couldn't work
Correct.
as well.
Correct. These are all different factors that affect the brain. Now, these are obvious. I mean, I kind of made them more dramatic. But the truth is, as I said earlier, there are several things that are going on under the surface that many people who develop dementia are unaware of. And so it's the job of people like me to point out these things so that you can be more aware and you may be able to seek help and do something about it. By the way, does everybody know that hearing loss can lead to dementia?
Yes.
Or loss of smell can lead to dementia? Does everybody know that? Okay. Does everybody know that taking antacids, proton pump inhibitors for an extended period of time can increase your risk of dementia?
When you said hearing loss without compensation.
Correct.
Yeah.
Without treatment. Yes, yes, I'm sorry. I thought I implied that, but yes, you are right. Hearing loss, loss of smell without compensation, and so on. So these are all things, and I had this picture here to show you that a healthy brain is about 30% larger than a brain that has been riddled with Alzheimer's disease. So it's not just a mood problem or a behavioral or psychological problem. It's an actual physical problem in the brain. Okay? And I love this definition by the Alzheimer's Association because this gets right down to the problem. And it says this: Alzheimer's is a disease that is caused by complex brain changes following cell damage. And I'm highlighting it there for a reason. Is a cell damage that eventually leads to dementia. And so this is like a picture. I hope I'm not going too fast. I just really want to cover a lot of things and also answer your questions. So there's a process, the progression here. There's damage. The brain tries to compensate, fix it. Sometimes it doesn't succeed and it gets worse and worse. But I think it's skipping a few steps. Because, I mean, how does the cell damage happen? Everybody's having cell damage, but not everybody gets dementia, right? Everybody. I mean, the older you get, you're exposed to all these toxins in the atmosphere. So there's no way you're not going to get damaged, but not everybody gets dementia. So what are the missing steps? I came up with what I call dementia's dirty dozen as a way for me to understand it, but also as a way to teach people that there are several things, the factors that can cause damage. I call them attacks on the brain. So some of them are deficiencies, some of them are basic damage, direct assaults on the brain. So infections, COVID-19 is a perfect example, by the way. You see infections here? COVID-19 has created a huge uptick in the dementia cases worldwide. Really bad thing. Anyway, like I said, we can't get into them, all of them. But
It says dirty dozen.
yes,
You didn't say what they are.
there they are. All in these.
I
Oh, you can't see the names? All right, I'm going to call them up. Illnesses, injuries, which could be trauma, insults, inactivities, insufficiencies or inadequacies, imbalances, insulin resistance, intestinal dysfunction or digestive dysfunction, infections, insomnia, isolation, and immune dysfunction. Does anything stand out to anyone?
Intestinal dysfunction, but
Yes.
you said antacid to combat that can cause dementia, isn't that what you said?
I know, it sounds really it sounds kind of confusing. But yeah, so one of the things that antacids do is that they block, obviously they block acids. Now, acids, the secretion of acids does a lot of things for the body. One of the things that it does is it helps you absorb nutrients like vitamin B12, which is extremely important for the brain. So if you're constantly blocking the acid secretion and not compensating for the nutrients that individual is losing as a result, then that increases your risk. Does that make sense?
I get it, yeah.
Is it including baking soda?
No, it does not include baking soda. Okay. So here's a picture. So basically, all I'm trying to do is kind of like just create a picture for you of how these things work. So I've kind of outlined it here. Dementia's dirty dozen, and we mentioned what they are, can eventually cause cell damage. If that cell damage is not fixed, eventually the brain's energy levels begin to dip, and it is not able to maintain the activities of the brain, and it continues like that. My opinion, as someone who has treated dementia and other brain disorders now for over 10 years, is that you can intervene at any stage here and prevent it from this happening. And the key is to ensure that your brain is getting enough energy. Now, obviously, there are other things that need to be done. You've got to help stimulate repair, get the brain cells working together back again, encourage healing, encourage the right atmosphere. But the number one thing that people tend to omit, and the number one thing that neurologists that I see, unfortunately, tend to omit, is the fact that the brain's energy levels have been depleted. Until you fix that, you are not going to have much success in treating dementia, and that is why we failed after spending upwards of $50 billion on researching and making medications for it. So I feel this needs to be addressed. All right, so what do you need to do to keep your marbles, right? This is a signature talk I give everywhere. And the bottom line is that there are three things I point out. Think of your brain as a city within a fortress. The walls are the protection, and of course the citizens are the neurons, the brain cells. The brain cells need a lot of protection. What we have found out is that there are three things that must happen in any individual who eventually gets dementia. One, they've had greater attacks. Number two, their defenses are weak. And number three, when things begin to go wrong, they did not get appropriate medical treatment. And so that thing kept on progressing and progressing. Okay, so the key, if you are going to take charge of your brain's health, the key is to do the opposite. You want to reduce the attacks, therefore, you need to know where the attacks are coming from. I mean, there's no way you can block an attack if you don't see it coming, right? So you need to know what those attacks are, but also you need to know how to strengthen your defenses. And you cannot strengthen your defenses if you don't know what those defenses are. Again, that's where the knowledge comes in. And of course, you need to know what tests to take from the doctor. Some of them are routinely asked for or ordered annually. Others, from what I've seen, are not. So I like to educate patients or clients and individuals on what tests they should specifically ask the doctors for. And sometimes you're going to get pushback. And I say, insist on it. Absolutely insist on it. One of them, of course, is vitamin D3. So many doctors are refusing to test for vitamin D3 levels now. You need to insist on that because healthy vitamin D levels, according to the Alzheimer's Association, have shown that you can reduce your risk of dementia by as much as 40%. For women, as much as 50%, and most of you here are women. If
you're not taking vitamin D supplements, especially during the winter, or you're not testing your vitamin D levels, you may be deficient and you may be at risk.
Sorry, I know it's only 15 minutes left, but we got this to work.
Oh, cool. So what do I do with this? Just put it on my.
You just hold
You
it
can
by your
hold
face.
it.
Okay, by my face. All right, okay.
Sorry, I just got it to work.
Thank you so much, guys.
Okay.
Okay, all right. So now you can begin to hear me, right?
Sorry.
I'll put it
Thank you.
Okay.
All right. So like I said, you need to check your vitamin D levels. To me, that's the easiest thing you can do. Yes, sir.
How much vitamin D do
Okay.
you need?
So I cannot, and I have to be careful here. For my patients, and most of my patients are international and in Nigeria, because black people have higher risk of vitamin D deficiency, I prescribe higher levels. But the standard is 600 to 800 international units. That is not enough. Again, I want to tell you this is what I do for my patients whom I know. I'm not saying you should do this. You go check with your doctor and do your tests. I don't recommend anything less than 10,000 international units a day.
That's a lot.
It is a lot. And so, like I said, that's for my patients. And I've been doing this for 10 years, so I take like 30,000 for myself.
So when you do take something like 10,000 and your blood work is showing that it's high,
Yes.
is that not a good thing?
Doctors panic when it's over 50. So the range that is accepted is 30 to 100 nanograms per mil. Okay? Some doctors, I know a cardiovascular surgeon who doesn't accept anything below 100. His range is 100 to 150,000. I would be more comfortable in general if people had 90, 80 to 90, especially women again. Many of the sleep problems that we talk about among women is because of low vitamin D levels. Women tend to be more deficient in vitamin D than men. So that's an easy way for most people. If you don't get anything from this, you need to get that.
And it should be D3.
Correct, D3. Thank you for pointing that out. Appreciate that. So D2 is one that doctors tend to recommend and give you injections for. They think it's more effective. It's not. D3 is more bioavailable. Is that an echo?
Yes.
Yeah.
You mentioned
But it might
B12.
not move here.
Okay. Thank you.
You mentioned B12 also.
Yes.
Also for,
I think you should test your vitamin B12 levels.
better.
Is that better? Thank you. All right, so let's quickly. So when we're talking about dementia support, if we need to change this, just let me know, and I can keep talking. All right. When we're talking about dementia support, I think about it in two aspects. So one is the care of the individual and their loved one. What we find out is that those people who are caring for their loved ones, they tend to get more vulnerable to disease themselves, and some of them eventually tip over to dementia, and some of them die. The numbers are 30 to 40% of all caregivers eventually die before their loved one does. So that is a huge thing we're leaving off that needs to be attended to. So I'm trying to partner with many people who know how to take care of what I call the secondary sufferers. So you've got the primary sufferers who are the patients themselves, the secondary sufferers. They need to be attended to too. They need to be supported. Now where I come in is that I focus more on addressing directly those biological changes that have gone on in the brain. Obviously, it's more difficult if the person has had it for many, many, many years, as opposed to those who are just beginning to have the symptoms. But my experience, and I come from a third world country, and most of my patients are in third world countries, nobody comes when they're just having a little memory issue. They come when it's really bad. And even at that, we have been able to see significant improvements if it's done the right way. It is all about the brain's
ability to fix itself if given the right support. Okay? So obviously, these are the different things we try to help people with. By the way, we're creating an online platform where people like you can go on and watch these videos. Again, we can't do much in 30 minutes, but we can have an access point where you can actually watch whatever suits your fancy, whether it's understanding how dementia works, to getting support, legal support or financial support, where it finds, because we have a lot of people, I have seen, we have a lot of people who know all these different areas, but they're not bringing them together in one place. And I believe that's what really serves the dementia, people who are living with or have loved ones with dementia, is the right information at the right time. And that's what we're trying to do about that. Our approach, by the way, I'm a physician. I am not licensed. I don't practice here, so I need to let you know that. So I am more like I said, over here in Baltimore, I am a brain health coach. All right? I do not treat, that's why I don't take insurance. So if people come to me for help, we let them know that up front. But then, once they sign a few waivers, I do not use medications at all. Everything I use are nutrients and what are known as nutraceuticals. Have you all heard that before? So a nutraceutical is it's a very powerful kind of supplement. They call them nutraceuticals because you know about pharmaceuticals, you know about nutritional supplements. So nutraceuticals are midway. But we have found that they are the most effective because basically what the brain needs is the brain needs to be fed and it needs to be repaired. So the nutrients provide the building blocks for the brain to repair itself. But you got to know what you're doing. I find most people simply don't know how to use these nutrients effectively. And it's not just the brain that needs to be addressed. I think that's another thing that tends to be left out. When the brain fails, it's because the other systems.
Turn it off. When the brain fails, it's because the other systems, the supportive systems of the body are also failing to some degree. So your the hormonal system, the gut, blood flow, these are all factors that feed and support the brain. So you cannot have recovery from dementia if you are only focusing on the brain. You gotta support everything else. I don't know why people aren't doing this. And again, this is not an indictment, but I'm really panicking. The numbers are not good, folks. The numbers are getting worse and worse and worse. So we gotta get this right. And we have to look at it from a holistic perspective. All right, so I'm going to give you a few action steps. My time is up already. Here are some of the things that you probably need to be aware of. All right? You want to reduce your sugar and ultra-processed foods. Most adults need more proteins. Now, if you can, it's harder to get it from plants. But if you can, that's fine. I mean, red meat has been vilified. People are turning around now. We're realizing that red meat is still one of the best sources of healthy food for the brain. I know it sounds strange. This world has turned around. Women sleep. A hip fracture is one of the worst things that can happen. It's worse among white women. Black women don't have that issue as much, but white women for sure. So you want to exercise to strengthen your hip and your muscles. There are certain tests that I always recommend. If there's nothing else you do, please take a vitamin D3 K2 supplement. These are dirt cheap and they're available on Amazon. And of course, your dentition, the health of your teeth, crucial to brain health. So also is hearing and smell. Those are all, when you lose those things without addressing them, they all have they kind of have an effect. So what we do is also, as part of the plan, we do one-on-one consultations. Again, I am not licensed to practice here, so I am a brain health coach, not a doctor. although I practice in Nigeria and other parts of the world as well. We are going to be doing live streams every Wednesday at 2:30. I'll be doing a free live stream where we'll be talking about these things, and I'll have guests come on. And then like I said, we have an online library which we're finishing up, where you can go back at your own time and watch for yourself. And these are the courses. These are the courses that are on that platform that we'll be addressing, the different modules. So we will talk about it from every. What does that mean? I guess that means time up, right? Is that a fire?
It's somebody's phone.
Is that a fire alarm?
No.
Okay. I do offer 15-minute pre-consultations. If you would like to be on the calendar, you can just take a picture of the QR codes and you can get on the calendar. So obviously, if we don't answer your questions here, we can definitely would like to answer them. Yes, ma'am.
I actually have a question about
Yes.
smell.
Smell.
I have Parkinson's and therefore I don't smell.
Okay.
Would that lead to dementia?
One single thing may not, but it significantly does increase your risk of dementia, even much more than hearing loss as well. So, two things. There's a company, I believe, in California, where they are actually helping retrain the sense of smell, where they send you different fragrances and it helps to retrain your sense of smell, and that has been shown to improve cognition. It's amazing. The part of the brain that deals with smell is also the part of the brain that helps the brain creates new brain cells. So it's a double whammy. Smell loss means also brain cell loss as well. So that's one. But so if somebody has, so if you are my client, for instance, I would say you need to start taking nutrients that will help to repair, improve the health of your brain. I would say proactively you need to start doing something about it, rather than just waiting and hoping. So there are supplements that specifically help the brain. Any other questions? Yes.
G3 plus K2.
Yes, ma'am.
It's in one
Yes.
bottle.
Yes.
You can take it or you have to take separately.
I take them together, because they're the right combination.
Another question. This is what we buying from the store, synthetic. It works or we have to look for something natural, more.
Man, watch out for the. It's okay, I got it. I should have said something earlier before. I got it.
It's good?